Hello there. Today's topic we'll be discussing is the factors whether, if you are diagnosed with a condition such as dementia or Parkinson's or Alzheimer's disease, whether you are automatically entitled to continuing healthcare funding. There's a very simple answer to this question, and sadly it is no. You are not automatically entitled to continuing healthcare funding if you have a particular condition, because it is not a diagnosis-led entitlement. Rather, it is in fact the position of what health needs you have that flow from the condition you suffer from. Only in the circumstances where your needs are considered primarily health needs, regardless of what disease or condition you have been diagnosed as suffering with, will you be entitled to continuing healthcare funding. It is not as straightforward as a simple tick box entitlement. Now, the rationale behind this is that there can be varying degrees of complexity surrounding having a particular condition, and in the early stages of a diagnosis such as Parkinson's or dementia, largely people may be able to continue with their lives unaffected. Clearly, in such circumstances they shouldn't be entitled to a full package of care provided by the NHS where they're not affected in a negative manner by the disease that they have. Now, as the condition progresses, clearly if this starts to impact upon their health issues, then this may well change, and it may well be that the balance has shifted and that their needs are primarily health needs, and at this point the entitlement to funding would automatically trigger. The reason for this as well is that sometimes people can have very serious health needs such that warrant continuing healthcare funding being provided, but have not actually been diagnosed as suffering from any particular condition. So clearly it wouldn't be appropriate to exclude those individuals simply because they haven't been diagnosed as suffering from Parkinson's or Alzheimer's disease. Now, whether somebody is entitled to continuing healthcare funding flows from a series of assessments and consideration of 12 separate domains, which looks at what the health needs of the individual are, and it scores them. The 11 needs initially considered and the 12th final other needs domain are behaviour, cognition, psychological and emotional needs, communication, mobility, nutrition, an individual's continence needs, their skin needs, whether they have any breathing issues, whether they have any circumstances of issues surrounding drug therapies and or pain management, and finally altered states of consciousness, and that covers areas such as suffering from seizures, strokes, and episodes of hypo or hypoglycemic episodes in nature. The final area is 12th domain, which is other needs, so anything that has not been encompassed within those first 11 areas would be considered at this point. Now, having assessed the individual across those 12 domains and scored them on a level of need from no needs, low needs, moderate needs and high needs, and in certain domains beyond that still to severe needs or priority needs, a backward step is then taken and the overall assessment is considered, looking at these levels of need, whether on balance the individual's needs are therefore complex, intense or unpredictable in their nature overall. It's not necessary to have them to be complex, intense, unpredictable in its entirety. Any one of those areas would suffice and they would be deemed to have primarily health needs. Now, continuing healthcare funding can unfortunately be a bit of a battle to secure. It can be quite a subjective assessment, and when one individual is conducting an assessment, their opinion may differ to another. Equally, we have experienced numerous instances of people not even being informed there is funding available, and even when the assessments have been done, they've been completed incorrectly, and individuals' needs have been underscored and they have been incorrectly denied the funding. As a company, we specialise in securing continuing healthcare funding and assisting people through every stage of this process. If you would like to discuss matters further, we offer a completely free, confidential, no obligation initial discussion, and we can deal with that either by you submitting a survey through our website at www.continuing-healthcare.co.uk or by calling us directly on 0121 227 8940. Thank you very much.